My name is Dr. Geoffrey Mutuma, and today I want to talk about kidney diseases. And kidney diseases are becoming very, very common nowadays. We have so many people who are on dialysis, and as we know that dialysis was not very common the last 30 years, 20 years. But now for the last 5 years, I don't know what has happened. We have so many people on dialysis, almost in every clinic, in every hospital, especially level 5 and level 4. Now they have dialysis machine, and there are people called to dialysis almost twice in a week. This is because they've got a renal problem. Now, why has the renal disease become very common? What has happened? Where have we gone wrong as a society and also as communities? Because we have so many people with renal failure. First is that, of course, you don't need to blame yourself when you've got a renal failure or renal diseases, because the disease is a disease. This comes to somebody anytime. But where is the issue? What's the major problem? Why do we have renal diseases? Why do we have so many people with renal failures nowadays? Why do we have so many people on dialysis? One is that we have so many cases of diabetes. We have so many cases of hypertension. And that's why in the other video, I talked about screening. And I talked about screening of cancer. But this time, I want to talk about screening for diabetes and hypertension. Diabetes and hypertension, we have a new emerging disease. In fact, it's not a disease, it's a crisis, because we have so many people with diabetes, we have got so many people with hypertension, and these two diseases, both hypertension and diabetes, they normally spoil the kidney. So whenever you have renal diabetes, whenever you have the kidney, whatever the damage, we normally call it nephropathy. Nephropathies are the pathologies in the kidney. Nephropathies in the kidney is because of hypertension, is because of diabetes, and that's why we find that diabetes and hypertension very common in the communities, and people having renal failure because of that. Of course, there are other causes of renal failures, not mainly diabetes and hypertension, and other causes is frequent UTI, urinary tract infection, and the infection go to kidney, causing nephrosis or glomerulonephritis, which is there, but not very common, because that does not cause a lot of renal failure. A lot of renal failures are caused by kidney, caused by hypertension, diabetes. And that's why, as far as screening is concerned, screen yourself, especially when you're 20 years. We used to think that diabetes and hypertension comes after 20 years, but nowadays we are finding that actually the diabetes and hypertension comes with people at 20 years, 25 years. We have people who are in their 30s or even late 20s, 28, 29. They already have renal failures, even they've got strokes because of high blood pressure, and even renal failure starting very early. So renal failure and renal diseases are becoming very common, and that's why it's very important to make sure that when you have diabetes and hypertension, those diseases are not painful. But remember, they normally damage your kidney. That's normally very important to make sure at least you check your kidney all the time. You make sure that at least when you've got diabetes and hypertension, don't keep on taking the drugs for a long time. What is very important, make sure that at least you take the drugs and you check the functions of your kidney and also of the function of kidney and also of the liver and the functions of the levels of your lipids, because those are the components which are going to spoil the kidney. What is very important is that the kidney is one which is used to remove the toxins from the body, the urea and the creatinine, which are toxins of metabolism. And that's why when you've got those renal failure, in fact, those they fail, and you normally have a lot of problems because you find that actually your kidney fails and you don't know and cannot remove those wastes. And that's why you have to create a machine which is outside you to function like the kidney, or you go and do a kidney transplant, which is not very cheap. So it's very important when you've got diabetes, when you've got hypertension, mainly make sure that at least you follow your kidney functions and you control the blood pressure and blood sugar, because those are the ones which spoil the kidney. So thank you very much. My name is Dr. Mutuma, and if you want to get me, my number is 0722 801299. That's the Safaricom, and the Airtel 07 34 801299. And subscribe to our YouTube. There's a lot of information we'll give, and we'll keep on giving this information, this YouTube channel. So always keep in touch, and also you can subscribe and invite your friends to be able to follow to get this information. Because this information is very important, because we perish because of lack of knowledge. And this knowledge is normally very important. And in our YouTube, we have got a lot of knowledge about health issues. Thank you very much.